So welcome back to part 2 of chapter 1. I do want you to make sure that you read the textbook talking about combining vowels and added to word roots. I'm going to hit the highlights of this section. So previously I talked about a combining vowel is added to a word root to make it easier to pronounce the term. And if you remember, some of our word groups like cardi or cerebr or crani or dermat or gaster, adding the combining vowel O on the M very often makes the combining form much easier to pronounce. So a word root plus its combining vowel is called a combining form. And usually we learn the combining vowels along with the word root that it's attached to. In this chapter, it's probably, and for the rest of the term and throughout the book, that's most often the way you're going to see the word root. Excuse me. Combining forms use the word root followed by a slash and the combining vowel. So what you're going to see, the combining forms are presented rather than just the word root. So the book presents cardio as the combining form. So word root, the vowel, an O, an I, or an E, and then you'll see the combining form. So here is a list of the combining forms, and it's really just important to memorize the spellings of these common combining forms and to remember that the slash before the combining vowel is used to indicate that the vowel may be used when the combining form is joined to following a word part. Just a few rules to learn about how they're spelled and how the parts are put together. So cardi is the word root, O is the combining form. Cerebr is the word root with the slash O is the combining form. So you still see that they mean heart, brain, colon, cranium, excuse me, skin, stomach, kidney, nerve, bone, and lung. And all of these particular combining forms have the O vowel to combine it with another word part. So here's an example of using the combining vowel when it's joined to a suffix. Remember, a suffix is at the end of a word that does not begin with a vowel. So here the combining form is nephro for kidney and logy for study of. So nephrology is the study of the kidneys, and you can see that that sounds very nice, and that's a word that you may already be familiar with. You don't use the combining vowel when a combining form is joined to a suffix that begins with a vowel. So if you have itis, it begins with I, and arthro ends in an O. You're not going to say arthroitis. So arthro joint, itis, inflammation. Instead, you're going to say arthritis, how we're going to spell that. So we're going to drop that combining O and just use the itis because you have two vowels there together, and that's inflammation of the joint. If the suffix begins with the same vowel as the combining form ends with, so you don't repeat that vowel, so cardio and itis, we are not going to say cardioitis, and we have an I and an O and an I there, so we're just going to use the cardi or the carditis. That's how you're going to put them together. So that's just really memorizing those rules. When you have a combining vowel and the two combining forms are joined together, even if the second combining form already begins with a vowel, so we have myo for muscle, cardio for heart, and al for myocardial. So you use the combining O for the prefix, myo, and cardi for the word root, and al for the suffix. And osteoarthritis, so osteo, you have the combining vowel O, you kept that, osteo. Arthro, but we have the itis, so you drop the O because there's two vowels, itis, so inflammation of the bone and joint, osteoarthritis. So see how these words are coming together, and if you just memorize those rules, it gets a lot easier with practice. So I definitely recommend completing exercise 6 in the book, where you practice writing the correct combining forms for the meaning of the words, and exercise 7 is really a good one, and I know there's more of those online in Stedman's, where you give the word parts and you write the medical term, and you'll practice those in the weekly exercises that you'll do, the weekly quiz that you'll do with me. So how do you put all these parts together? So generally they're based on how the terms are spelled so that they can be pronounced more easily. And you really need to get in the habits of saying the terms aloud. Again, I refer you back to the Stedman student resources where you can click on the words and they say them out loud. So what about plural endings? So some medical terms use the common, most commonly, if they're plural, you add an S or ES at the end. So for example, the plural form of student is students with an S, and some medical terms also add an S or ES to make them plural, but many do not. So they have special endings related to their origins in Greek or Latin. So for example, if the singular noun ends in an A, as in vertebrae, referring to one bone in the spine, then the plural ends as an AE, as in vertebra, referring to multiple bones in the spine. So what you can see in this table here is this shows some of the special plural endings common in medical terms, and these special plurals do not occur with all terms ending in those letters. For example, the plural of sinus is sinuses with the ES, but in most cases you have to learn the plural form when you learn the term. So examples are, as we talked about, vertebra, a spinal bone, or vertebrae, foramen as a whole, or foramina, pollex for a thumb, or pollices, ganglion, or ganglia, ankylosis or ankylosis, testes or testes, phenomenon or phenomena, spermatozoon or spermatozoa, appendix or appendices, epithelium or epithelia, diverticulum or diverticula, atrium or atria, nucleus or nuclei, embolus or emboli, phalanx and phalanges, and biopsies or biopsies, or biopsy or biopsies. And these you really need to memorize all of those terms. I could see in any medical record at any time, and you need to understand when something is plural and something is not. So it's very important to understand that spelling medical terms correctly in healthcare is very vital. For example, misspelling a term in a patient's record could cause confusion or even a dangerous situation if another healthcare worker misunderstands what you've written. And many terms look nearly alike and may even be pronounced the same. So for example, like it's here, ilium and ilium look similar and sound alike, but they're two very different parts of the body. Ilium is a part of the small intestine, and ilium is a hip bone. And they look similar and sound alike, but they designate two very different parts of the body. So it's important that you take the time to learn correct spellings and complete the spelling exercises in the chapters and be able to write out the terms of the exercises. And very important, I am going to count your answers wrong if you do not spell them correctly. That is the whole point of this course. This funny little cartoon, Jenkins, you fool, I said balloon stent, not balloon stent. So it's humorous, but dangerous things can happen. So be sure to use the pronunciation keys that are provided in the text and in the online resources. It's very important to learn the pronunciation at the same time you lose a term. You learn the term. I know a lot of times people will listen to the live lectures in the beginning, and then as they progress think, oh, I read the book, or I'm getting good at this, I don't need to hear these terms, or I work in a healthcare facility. I find that people that get A's in this course are the people that listen to the live lectures and follow it along in the book and do the practice questions and use the online pronunciation resources, really do the best, and in the long term get the most out of this course. Saying the term helps you remember its meaning and spelling, and learned how to use the stress marks, which indicates which syllables or syllables should be accented. So the stress marks tell you which syllable to say more forcefully when you pronounce a word like nucleus, and not like this, nucleus. There's lots of pronunciation tables provided in the chapter that are helpful, and those are some of the tables that are in the chapter. So let's remember: read, write, speak, listen, and when you use your senses. And that's really why I make the live lectures, is some people, even though it's an online course, do much better when they listen. You can listen to these live lectures when you're working out, when you're in the car, on your phone, however you want, but reinforcing learning assists in your memory. So don't just passively read the terms on the pages. Listen to the live lectures, practicing the words out loud. Listen to me say them. I try to say them all right, but it just takes practice, many, many years, especially when we get further along in the course. You're going to be reading some medical records. I try to read those out loud and look up words that you do or don't know. So it's very important to make sure that you read, write, speak, and listen these terms. Remember that the meaning of medical terms comes from the meaning of different word parts, and together they make that term, and there's a little value in trying to memorize each and every medical term separately. It's much easier to learn the meaning of parts and then apply those meanings to the many terms and use the same parts. So analyzing word parts to understand a larger meaning is also useful when you encounter a medical term for the first time and you don't have a dictionary or your textbook available. And quite often you'll be able to figure out the meaning of a new term if you know the meaning of its separate word parts. So analyze the steps of doing this are not what you think. You think, oh, analyze the meaning of the root or the roots first. But really, the breakdown of this process is to analyze the meaning of the suffix. That's the part of the word at the end. And then analyze the meaning of the prefix, and then analyze the meaning of the root or roots. So here's a great example. Intracerebral. So all means pertaining to, remember, and intra, within, and then three, cerebro, or brain. So pertaining to, within the brain. See how we broke that down, and you'll get really good at that. You really need to learn terms by breaking them apart and analyzing the meaning of the parts, and then this can also help you learn terms by putting the word parts together. So here's another example. You know that cardio means heart. You know that itis means inflammation. So how do you build the term for the inflammation of the heart? Think about it. Cardio root, itis suffix, repeated I, so you're not going to use the I there twice. The wouldn't be cardiitis or cardioitis. So carditis is how you put that and build that term together. And medical terms include the following basic parts: word root, prefix, suffix, so intracranial, intercranial, and so. Be sure to analyze the parts, build your medical terms, and you can go from there.